I think we're going to get started. Dr. Birken is co-presenting and going to moderate just because I didn't get pulled out. But these are going to be joint Leong Center and CHES rounds today on screen use and EQAO. A lot of really interesting work from her team. Over to you, Dr. Birken.
Okay. Ooh, that's loud. That's too loud. No? Okay. Hi, everyone. Nice to see you all. Come on in. Okay, so I'm Catherine Birken, pediatrician and researcher as part of CHES and SH Leong Center, and I'm really thrilled to introduce my other teammates. We're going to present today on child screen use and EQAO outcomes, building collaborations to evaluate interventions and policies. So I am a general pediatrician in the Division of Paediatric Medicine. I'm a professor of pediatrics at U of T and a senior scientist here in CHES. And I'm one of the Edwin S.H. Leong Chairs in child health intervention. And my clinical work is in the Health and Living Clinic, which is obesity treatment here at SickKids, and the inpatient unit in pediatric medicine. And my research, this is a large part of my research. I co-lead Target Kids, which you'll hear about. And I'm thrilled to introduce my colleague, Zudy Lee, who's an epidemiologist in Target Kids. She holds a Bachelor of Science and Master's from U of T, and she helps works on analytic plans, conducts statistical analysis, and contributes to grant writing. And today she'll be talking about our longitudinal cohort data. So I'm really excited for her to present her work. And then Michaela is a registered dietitian and PhD candidate in nutritional sciences at U of T with an MHSC in nutrition, meal communication in nutritional sciences. And her research is on obesity prevention and improving dietary quality in children. And she continues to do a lot of community engaged research with our team and knowledge mobilization within Target Kids. So that's all for the introductions. I'm going to start off and then we're going to hand off with each other. Okay. This is working. Mac. Okay. Okay, so I'm going to tell you a little bit about Target Kids and our child screen time research. I'm going to speak about how we've been able to link our data in Target Kids with EQAO. We're going to speak about one of our published findings on child screen time in EQAO. We're going to speak about some work that's underway that's not yet published for your feedback. And then we're going to launch into health education collaboration and community engagement with health and education sector, and then speak a little bit about some ideas that will be moving forward soon. So our learning objectives are to describe the health and education linkage and collaboration between our Target Kids cohort and EQAO, to understand the associations between child screen use, including screen time and mealtime screen use, and EQAO academic achievement outcomes in children, to recognize the value of cross-sector collaboration and community engagement between the health sector and the education sector, and to identify future opportunities for screen-related policy evaluation and intervention. So let's start with Target Kids. If you haven't heard about Target Kids, we are an applied research group for kids. We are a community practice-based child health research network working with community healthcare providers, largely in the Greater Toronto area. And we follow children through their interactions with the primary and secondary health system, all the way from early childhood through adolescence. We work with more than 13,000 children and their families, and we started our work in 2008. So we've been following children for a long time, and we continually recruit new families and children into our cohort. So it's always changing and growing. And our broad goals are to help children grow, learn, and thrive through research that supports healthy growth and development, starting early in life. So this gives you a bit of a pictorial representation of the clinics that we work with. So young children, when they come with their parents to the healthcare provider for their checkups, that's when we interact with them within the network. And we have 13 large participating clinics with many, many physicians and healthcare providers working in those clinics. And we've work with trained research assistants that actually become part of the healthcare team. They're embedded in these sites, and they get to know the families, approach the families, collect survey information, growth measurements, and other measurements in the health system, and then other health information. And we've been working on expansion into other kinds of healthcare settings. For example, there are health in Greater Toronto area, there are health clinics that are embedded within school systems, and other kinds of practice like community health centers that may not be your traditional community pediatrician or physician offices. So these are the types of data that we collect that families share with us. So of course, there are parent reported questionnaires where we collect information like sociodemographics, nutrition, screen time, physical activity, and sleep information. We do collect some developmental screening. We include mental health assessments and well-being and service use. We also do direct measures with children and parents, and these are typically measures that are happening in the health system as part of practice. So that includes height or length, weight, waist circumference, blood pressure as some examples. Depending on the study, we do collect blood samples, and we look at some related outcomes that may be related to cardiometabolic health. And we also have linked all of our data to OHIP through ICES. So this gives us access to inpatient care data, emergency room visit data, physician visit, some electronic medical records, and mental health service use as examples. And then over the last few years, we've been working to collect learning and education data, and that includes asking family about their school and childcare participation, trying to collect attendance data. We've been working with the Early Developmental Instrument, which is an instrument completed by kindergarten teachers about children, and what we'll talk about today is EQAO linked data. So I'm going to shift gears to tell you a little bit about why we're interested in this topic area. As you know, children are exposed to very high levels of screen use now from earlier and earlier ages. And this is despite, current guidelines in Canada and elsewhere to try to limit some of this recreational screen time. And just to remind people, the Canadian Paediatric Society and many other groups have very similar recommendations, and that is for screen use is not recommended for children under 2. From children 2 to 5, there are recommendations to limit screen use to less than an hour a day. And the Canadian Paediatric Society uses an approach that they call the 4 M's. So try to help families around minimizing the screen time, mitigating the use, so trying to do co-viewing or other ways to reduce potential harms from screen use, thinking mindfully about screens, what screen use may be more healthful than other screen use, and modeling, so trying to role model healthy screen use from families. And we know that total screen time, just summing up all the screen use that we're all using and our children are using, is an important measure of child health behaviors. But in addition, the type and the context of screen use also matters. We know that high amounts of screen time are linked to negative health, mental health, and education outcomes from other research. And these are just a few examples of some of the work we've done over the years. We've linked our screen use to developmental screening tools. And this is work from Mette Vandenhovel, showing that each additional 30-minute increase in daily total screen media use was associated with an increased odds of parent-reported expressive speech delay. And those kind of associations have been shown since in other studies. As I said, we linked our screen use data with school readiness, and this is kindergarten teacher reporting development of their students in kindergarten. And we showed that higher screen use at this time period in early childhood was associated with increased vulnerability on this EDI measure of school readiness. That's work from Lee Vanderloo. And then over COVID, this is work from Zuding Lee. We combined the data from Target Kids with 3 other cohorts. That includes SickKids Psychiatry, the PON neurodevelopmental cohort, and Spit for Science, which was a community-based study. And we found that screen use was associated with increased risk of mental health concerns during the pandemic. And then finally, I wanted to mention that we're doing a lot of work. This is work being led by Len Tulani and Ashley Vandermorris, really trying to ask our youth and youth researchers, what are issues around screen use that are important to you? And then how should we best measure screen use and other related health outcomes? So in addition to a parent advisory group, which we have in Target Kids, we also have a youth advisory group, and this was funded through CHR Catalyst Grant. Okay, so how do we do it? How do we link our health data that we've been collecting over the years with EQAO data? And just to remind people, EQAO stands for Education Quality and Accountability Office. They're a provincial agency that's arm's length from government, and they're responsible for collecting academic achievement data in children and students in Ontario. So they, since 1996, this group has been measuring students' academic achievement through annual province-wide standardized assessments in reading, writing, and math in grade 3, 6, 9, and 10. And if you've been a student in Ontario or a parent of students in Ontario, you likely remember the EQAO. And it is an important indicator of student learning and helps the Ontario education sector improving student achievement and well-being. Also, the EQAO, there's a voluntary student completed tool that they complete at the same time, asking students about their own perception of their reading, writing, and math, and some other really interesting questions that they have added over time around student sense of belonging, their sense of assistance and help with in the school system from peers and educators. The test results are reported in terms of levels of achievement, so below, at, or above the provincial standard for each subject area that's defined by the Ministry of Education. So we developed and established a partnership with EQAO with a signed data sharing agreement, and that includes an established algorithm for securely linking participant data with EQAO records. And just to let people know that in our work in Target Kids since 2012, we've consented parents and children to share this data. And that's a little bit unique because there are other efforts underway to link health and education data with EQAO that do not require consent, but our work today, requires consent. So when we perform this analysis, which we'll share with you today, we have about 3,400 participants in Target Kids that also have all the rich Target Kids data linked to the grade 3 EQAO testing and student questionnaire, and around 2,200 children with grade 6 data. And we're working right now on linking with the grade 9 and 10 data. So I'm going to hand it over to Zudi, who's going to share the results of one of our main papers, and I'll be back.
Thanks, Catherine. Okay, so I'm very excited to share with you our study looking at screen time and academic achievement. So this study was published on JAMA Network Open last October. So Catherine touched a little bit on screen time before, and we all know academic achievement is an important indicator of education success and is linked to later health and education outcomes. In terms of the mechanism of how child screen time might impact their academic achievement, screen time could displace academic promoting activities such as sleep, family time, as well as physical activity. It could alter brain structure with excessive use. It might impede social development due to distractions. Alternatively, it could enhance learning through access to resources. So systematic reviews found negative associations between TV viewing, video gaming, and academic achievement in children and youth. But most studies were cross-sectional and focused on older children and youth. So it's important to study screen time in young children because screen behavior patterns are established during the early years and a child's earliest screen encounters are habit forming with patterns of exposure often persisting into later life. So understanding the relationship between early screen use and academic achievement could help identify key targets for prevention and intervention implemented early in the transition to school. So for this study, our main objective was to determine if total screen time, TV digital media time, as well as video game time in young children were associated with grades 3 and 6 EQAO standardized tests in reading, writing, and math among children in Ontario, Canada. So for this study, it was a prospective cohort study between 2008 and 2023, and we included children 0 to 12 years participating in the CHES Research Network. So for the exposure, we looked at child screen time collected. So we have been collecting repeated parent-reported child screen time data since 2008. And we use the closest data point collected prior to the EQAO test in the analysis. So the latest screen time data before the grade 3 test was used as exposure for the grade 3 analysis, and the latest data point before the grade 6 test was used for the grade 6 analysis. And we looked at 3 types of screen use: the total daily screen time, TV and digital media time, as well as video game time. And for the outcome, we looked at grades 3 and 6 EQAO reading, writing, and math results. So it was an ordinal variable categorized as below, at, or above the provincial standards. For the analysis, we used proportional odds model for the ordinal outcome. We first assessed the assumptions, and we performed separate analyses for grade 3 and grade 6, as well as for reading, writing, and math. And we adjusted for a number of covariates. So this study included 3,322 children with grade 3 data and 2,084 children with grade 6 data. So here's the table 1 showing the participant characteristics. We have about 51.6% male students, about 58% with a child reported a European ethnicity, about 50% with self-reported family income greater than 150K per year. So for children with grade 3 test data, the age when the closest screen time data point before the test was measured was on average 5.5 years. On average, total screen time was 1.6 hours per day, primarily from TV and digital media time. So because we looked at the distribution of the video game time variable, and given the young age of our participants, most children did not engage in video gaming at the age of when the screen time was measured. So because it's highly skewed towards 0, we analyzed this variable as a binary variable, so any versus none, instead of a continuous measure. So in children with grade 3 data, 21% were video game user. And for the outcome, mean age when grade 3 tests were measured was about 9 years. And the majority of our sample were at the provincial standard for reading, writing, and math. And we had more variability in the results of math. For children with grade 6 data, screen time on average was measured at 7.5 years, on average 1.8 hours per day. And mean age when grade 6 tests were measured was about 12 years. So I first want to show you just descriptively what we found. So simply just describing child total screen time by EQAO, grade 3 EQAO test results. So the purple bars here represent total daily screen time, hours per day, and the x-axis represent grade 3 EQAO test results. So you have below, at, and the above provincial standard group. So you can see a clear trend that screen time was the highest among children in the below provincial standard group and the lowest in the above standard group. And we can see the same trend for grade 3 writing, as well as math. So that's total screen time by grade 3 EQAO results. And this graph is for children with grade 6 EQAO data. So again, a similar trend was observed. Highest screen time in the below standard group, lowest screen time in the above standard group across all subject areas. So that's just descriptively describing, comparing children's screen time in different achievement levels. Moving on to the actual analysis results. So using a proportional odds model, we looked at 3 types of screen time with reading, writing, and math in grade 3 and grade 6 separately. So we can see clearly that there was strong evidence that total screen time as well as TV digital media time were associated with lower achievement in grade 3 reading and math, as well as grade 6 math. We don't really see anything with video game use because, again, most children in our sample do not engage in video gaming even at a young age. So this might have limited our power to detect associations. So just the interpretation of the odds ratio here, for example, here is odds ratio equals 0.90, means that every additional hour per day of total screen time was associated with 10% lower odds of achieving a higher academic level in grade 6 math. So in conclusion, in this prospective cohort study of children recruited from community primary care settings in Ontario, Canada between 2008 and 2023, higher levels of parent-reported total screen time as well as TV digital media time in young children were associated with lower academic achievement on the EQAO tests in reading and math. That's after adjusting for confounders such as child age, sex, ethnicity, maternal education, family income, IEP status, as well as year of test. So in terms of the strength and limitations of the study, so for strength, we have a large sample size with linked prevention standardized testing data. It was a longitudinal cohort looking at 15 years of data between 2008 and 2023. We were able to look at different types of child screen use and adjusted for multiple confounders. However, parents reported child screen time may have introduced errors and biases to measurement. We did not look at content or context of screen use, which includes screen use at school, which is a very important aspect of child screen exposure. We could not determine a causal relationship based on the associational analyses. And lastly, generalizability may be limited to urban children recruited from primary care settings. So overall, our results are consistent with existing literature showing a negative association between high screen time and lower academic achievement in children and youth. So early interventions to reduce total screen time and TV digital media exposure should be developed and tested to enhance academic achievement in elementary school. And also, Michaela will speak more about it, but cross-sector collaboration is very important. Health and education sectors cannot work in silos. We must work together and leverage data linkages to drive meaningful impact. So lastly, I just want to briefly touch on our knowledge translation work. So we were very lucky to partner with the EQAO to help share this work with educators, parents, and caregivers across Ontario. So this February, we had the opportunity, so Dr. Catherine Birken, Dr. Jessica Coleman, and myself had the opportunity to present this finding at the EQAO Data Symposium, attended by over 180 school board leaders, superintendents, educators, and researchers across Ontario. So there was a lot of interest in this research, and many educators actually raised important questions about screen use at school, which is one of the key areas that we are interested in exploring in future research. We also had the opportunity at the beginning of this month to present these findings to parents and caregivers through an EQAO parent and guardian webinar with over 800 people registered. And it was a great session with lots of engagement and questions from parents. So this paper also has gotten some media attention, featured by Toronto Star as well as CBC News. So that's our study looking at screen time and EQAO. So now I want to share with you our unpublished findings, looking at mealtime screen use and academic achievement. So we know from this study, the previous study, duration of screen time is important. But in addition to how long, current recommendations also emphasize the importance of how and when screens are used within children's daily routines. So both the CPS, the Canadian Pediatric Society, as well as the AAP recommend turning off devices at mealtime, so screen-free meals. So mealtime screen use is an important context of child screen use, and in order to generate actionable evidence that is directly relevant to parents and families, we asked, is child screen mealtime screen use associated with the EQAO? So for this study, we used a similar study design as the previous study. So again, since 2008, we've been asking questions to our parents on child screen use during breakfast, lunch, dinner, and snack times on a typical weekday and a weekend day. So for the primary exposure of this study, we looked at the average number of meals per day with screens on. So we converted into a continuous variable from the questionnaire. So each yes response was coded as 1 and each no as 0, and a weighted average was calculated by multiplying weekday responses by 5 and weekend responses by 2, and then dividing the total by 7 to reflect the average number of meals per day with screens on across a week. And for our secondary exposure, we looked at screen use during specific meals, so during breakfast, lunch, dinner, and snacks. So same outcome, grade 3 and grade 6 EQAO reading, writing, and math results, and same statistical models using a proportional odds model. So this is the results of the primary analysis. So we can see that mealtime screen use was associated with lower achievement in grade 3 math, as well as grade 6 across all subject areas, so reading, writing, and math. So again, the odds ratio for, let's say, 0.83 here means that for each additional meal per day with screens on, the odds of achieving a higher grade 6 math level are lower, so 17% lower odds. And that's after adjusting for a number of covariates. For our secondary analysis, looking at associations with specific meals, so we found that screen use during breakfast was associated with lower achievement in grade 3 math, as well as lower achievement in all grade 6 subject areas, so reading, writing, and math. And screen use during snack time was associated with lower achievement across all grade 6 subject areas. So it's important to note that lunch, because lunch is most often consumed at school, so parents may not always know what happens during lunchtime. So parent-reported lunchtime screen use during weekdays might be underreported. So that's a limitation of this study. So in conclusion, higher child screen use during meals was associated with lower academic achievement after adjusting for the covariates. Each additional meal per day with screen on was associated with 12% to 7% lower, 12% to 17% lower odds of achieving a higher level on the EQAO test. And breakfast and snack time screen use appear to be the primary drivers of these associations. Some potential mechanisms of this association. So first of all, mealtime screen use could displace important parent-child interactions, such as conversations and language-rich exchanges. It could reduce language exposure and learning opportunities during routine daily interactions. Mealtime screen use could disrupt attention and focus, particularly during the cognitive sensitive periods, such as right before school. It could promote less structured eating environments with more frequent screen use during snacking. It could increase cumulative screen exposure through repeated daily occurrence. And for the secondary findings, secondary analysis, breakfast could be a cognitive excessive period. So screen use in the morning right before school might disrupt attention and readiness. And snack time screen use might reflect frequent exposure, leading to repeated screen use, distracted eating, and poor dietary intake. So overall, our results align with the current child screen use guidelines and support a very clear, actionable, and direct guidance for family that avoiding screen use during meals for children could be a practical strategy to support child academic achievement in elementary school. So I think that's it for me. I will pass it off to Michaela to talk a little bit about our health education collaboration work.
Thank you, Sudi. So as Sudi mentioned, I'm going to be sharing some highlights from our Health and Education Forum, which is an initiative designed to strengthen partnerships between Target Kids and the education sector. So the vision behind this work is to optimize children's health and development through integration of child health and education data, form relationships between Target Kids and educators to enable meaningful research, and to use real-world data to advance health equity for children, youth, and their families. So the forum was a full-day in-person community event in this building that took place in October. And to begin building these partnerships, this forum brought together 15 educators representing both teachers as well as other interest holders as listed on the slide across different school boards and education organizations, 10 researchers from several institutions, as well as Target Kids investigators and staff, and members of our parent and clinician team, or what we often call the PACT. Bringing together these different perspectives helped to create opportunities for meaningful cross-sector engagement. So an important part of Target Kids, as mentioned, is our PACT. PACT members are parents whose children participate in Target Kids, and they work with us throughout the research process. So for example, they help identify research priorities, provide feedback on study design and questionnaires, and contribute to interpreting findings and knowledge translation efforts, to name just a few of the activities. Including parent voices ensures that our research addresses questions that are relevant to families and helps the team produce more meaningful findings. And Daniel is highlighted on the slide as he was the PACT representative at this event and is also a teacher, allowing him to contribute in kind of both ways. So of importance, these parent-identified research priorities serve as the foundation of much of the work within Target Kids, and we intentionally shared them with educators within one of the activities that I'll discuss shortly to stimulate discussion around the questions that they see as most important in child health and education and identify potential overlap with parent priorities. And you can see as the discussion today and focus of the presentation, one of the top priorities is appropriate amount of screen time for children. So the forum began with an introduction to Target Kids and the multidisciplinary research team. And then next we used the forum as an opportunity to share relevant research findings from our group. For example, we shared research demonstrating how factors such as nutrition, sleep, physical activity, screen time influence children's development and school readiness. And we provided these infographics that are shown on the slide, although they're not, you can't see them perfectly clearly, but we provided this as a dissemination resource for those who attended to take home and share with their boards or schools. And then we also introduced the new opportunities that are being discussed today, including linkages with the EQAO education data and several ongoing and upcoming pragmatic and systems trials. And then the second half of the forum really focused on collaboration and activities. So participants completed an education priorities exercise to identify the most pressing research questions from the perspective of educators. We discussed how many research questions and areas either aligned or did not align with the parent established priorities within Target Kids. Many very intriguing questions came up around screen time and the use of screens within schools. But a really big important takeaway from the entire exercise was that those in the room were really eager to understand how various factors influence child health and education and learning outcomes, underscoring the need for stronger dissemination efforts, as well as how deeply committed they are to supporting their students within schools and really want to know how to meaningfully do this within classroom settings. We also held cross-sector discussions to explore how researchers and educators can work together more effectively, the barriers and facilitators to doing that, and then ultimately the value of collaborating. So to conclude, this forum was just the first step in building stronger partnerships between health and education. Moving forward, we hope to continue these activities and building partnerships with educators, such as the establishment of an advisory board within the education system. We will continue facilitating knowledge dissemination efforts within schools through newsletters, infographics, and other initiatives and opportunities that were identified by educators to better share our findings. And we'll continue to seek funding, of course, to support these efforts and prepare a manuscript for a publication to share these findings. But in the meantime, we've created a summary document that's available on the Target Kids website, and it provides more detail on the findings and the conversations of the forum. And you can also scan the QR code if you're interested at the moment, as I pass it off to Dr. Birken.
Thanks, Michaela. So I just wanted to acknowledge Zubin's excellent presentation of the analysis and Michaela's presentation. And also, I think Priscilla may be online, Priscilla Medeiros and the Leong Center for really working to assist, lead us through all this community engagement work and what are the best methods to actually do community engaged work, and how do we share our findings with a larger community such as yourselves. Okay, so we wanted to end just thinking a little bit about where to go from here, and really looking for your questions and feedback around where we might go with some of this work. I think when each time we present this work and construct the analysis, we are all very mindful of not shaming and blaming parents and ourselves. If you have an iPhone and you have to take a look at your own use, it's actually quite horrifying. It's horrifying to me, my use. So, screens are really ubiquitous. We're all using screens. Our children are using screens. And so supporting healthy screen use cannot simply be the sole responsibility of parents and children. It has to be a societal effort. That includes schools, communities, technology companies, governments, and really thinking about what each role might be and how we might think about working together for the health of ourselves and our children and families. And thinking towards what policies might be existing or around the corner for us. So you might know if you have school-aged children or been reading the press, Ontario actually has introduced school cell phone restrictions in classrooms. We can chat about how those have been implemented because it's seemingly quite differently across different schools, classrooms within schools, and different boards. And then we have heard a lot recently about likely new legislation coming to Canada. And also legislation internationally about different policies around social media use and online harms and online safety. So this is really a fertile area of policy that we're living through. And, we're interested in the work that we're doing in trying to unpack and evaluate some of those screen time policies, because we're in the position that we've been collecting at least some screen data prior to all of these policies throughout the policies. And if they, and if the policies change post implementation of policies. So this is Bill C-34. And I don't know if there are any people from the accelerator here or online, but this is called the Safe Social Media Act. It's really focused on age restrictions, and platforms must prevent children under 16 from having an account on some social media platforms. And there's certain opportunities for exemptions. There are some statutory duties, so a duty to protect children and a duty for social media platforms and AI chatbot services to act responsibly. There are provisions in this legislation for both content and design protections, and also proposing the establishment of a digital safety and data protection commission to set guidelines and enforce compliance. And these are some of the key milestones for online safety legislation in Canada. So some of this work has been supported through the SickKids Accelerator that has been involved with training, ongoing government consultations. In May, the introduction, was it 2 weeks ago now, of Bill C-34. There will be the end of the summer break for the federal legislative session, and then back in the fall, this bill will be debated in Parliament. There may be legislation, to be implemented as soon as, let's say, the winter. So, when this situation happens, it would be really amazing if there was an existing community-based data infrastructure where we've been in Canada, across all the provinces, have been collecting data from parents, from children, from different sectors on their screen use and the perception of this plan. But there is no, sadly, existing coordinated system really to monitor these kinds of things in Canada. So we've been, along with the Leong Center, convening a group of investigators that happen to have an interest in this area or have an existing cohort that they've been working with and have been doing work in this area to try to come together and see, because we don't have a national system, what are ways that we could sort of collaborate together, harmonize some of our tools, and then be in a position to evaluate these policies. So some of our ideas about next steps are to really try to harmonize a short list of items. And we've been fortunate to be collaborating with some experts. For example, there's experts at the Stanford Digital Media Lab that have actually been leading the evaluation in Australia, because Australia implemented social media harms legislation about a year ago. So they are doing an evaluation in Australia. We're trying to collaborate to really learn, what things worked in your evaluation, what things did not work in your evaluation, so we can learn and move this field forward. Hopefully, not repeating any challenges that they faced. So the idea is and they have shared their tools with us. So the idea is to take this massive questionnaire that they've developed, which is probably not feasible in our current research environment in Canada, try to harmonize a set of core items from those tools. And then if we have enough time, hopefully prioritize getting feedback from parents, from youth, from educators. Are these the right questions? Do we miss some important questions? What do you think the key priorities should be? Have an iterative process with some of the people that are already in the field, and then really try to work with existing cohorts, existing national surveys. There's 1 or 2 national surveys to try to implement some of these tools more widely. That's it. Oh. So that is the end of the presentation. And I just wanted to acknowledge all the amazing work of our Target Kids team. There are people in the room that are contributing, and our investigators on our team. So I wanted to acknowledge to you all. And we have a good amount of time for questions, comments, and we'll try to look at those comments online. So maybe Zudi and Michaela want to come up and we can answer some of your questions. Okay, so we can start with the room. People have questions, comments.
Thank you all. That was really great presentation. I've learned a lot from this. I was wondering about, I guess not just like online.
Oh, yeah, we're here. Even better.
That was great. Thank you. Yeah, I wondered about I guess, not only sort of screen time, but just how you think about changes in what kids are doing with their screens, and which, your cohort started in 2008, I think you said. So, lots of things have changed in terms of what kids are doing with the screens over that time, and if just what you think about that, if you can overlay that with any of your analyses, and then is that potentially useful information for where you might like target interventions?
Yeah, maybe I could start, but we can all chip in. Great question. So I always say we need an anthropologist because we've been asking screen-related questions since 2008, so before the iPad, if you can imagine the world before the iPad. So that's been like a really interesting research exercise because we've changed our questions to accommodate new technology, but we also didn't want to change our questions too much because we want to use the rich longitudinal data. So that itself, I think, is like a methods question to ask. And you're absolutely right. Of course, it's even more complex. So it's what are the children doing on screens? How has that changed over their lifetimes? And and how to map that with their development. And then what is accessible to them, which is completely different now. And also at home, people have, if you think of your own family life, people have multiple devices. It's not just a phone, an iPad. Some families have many families have shared devices. People don't tend to get rid of their devices, so you pass it down to your children. I mean, which is, if we reflect on that, that's also interesting. So there's the type of use, what they're doing, how they're doing it, what is it linked to, when are they doing it? Is it during meals? Is it before bed? Is it at school or not at school? Is it part of their homework club? So there's all those contextual issues. They're so interesting and likely so important. So trying to incorporate all of that data is a big challenge, but also exciting. I could also mention, I don't know if you want to talk about, like one of the key issues in this field is we're asking people to report their use. So we're asking parents and children to report their use, but we know from ourselves that may change actually as the children age because you have more control. So there are many groups that are trying to do direct data collection. So how can we get the information, like the media companies know how much we're using. We're doing a project this summer on trying to collect screenshots if parents are willing to share their screenshots. Other groups have used apps, but people tend to not want to download the app to collect your screen use on their phones or their devices. So I don't know if you have anything to add to that.
Yeah, thanks, Gavin. Great question. So yeah, like Catherine mentioned, we started in 2008, and in 2008, our questionnaire asked DVD use. Like that was like 15, it's so cute, 18 years ago. Yeah, so it's always a balance between, keeping the longitudinal data and introduce kind of new questions into our cohort. But right now we've been collecting in our new kind of target kids questionnaire, we're collecting content of use, like for education purposes, for other recreational purposes. We're also collecting, like Catherine said, context like before bed, during mealtime, as well as we call it technoference. So technologies interference or interruptions on the family's daily lives. So we've been collecting that. So hopefully we can look at all these, contexts and contents and link that information with the education outcomes.
There is a question online, maybe we can go there. Ashley wants to ask a question, but I can read it. What guidance would you provide to parents and clinical teams about children attending medical appointments who are inpatient or often rely on screens to get through visits or admissions? This may be a tricky issue. Yeah, I think that's a great question. We know that distraction is a really good strategy for painful procedures. So first of all, the research that we've done to date is not measuring that at all. So the findings that we're sharing, it does not at all reflect that question that you're asking. So I want to make that really clear. Yeah, I think there are different settings where screens can be very, very effective. So I think I wouldn't want to generalize our findings to those situations. I guess there's also questions around, is it hospital admission an opportunity to discuss some of these issues, or probably not an opportunity to discuss some of these issues? So I think that's a great question that we can reflect on. Someone else can, oh yeah, go ahead.
I always wondered, do you guys collect data on like what screen it is? Because Instagram tells me that there are these like, I have two very young nephews, so I get a lot of Instagram feeds about this. But apparently now they're coming up with like non-screen screens. I don't even know what that means, but I guess it's like a Kindle version of screens, and like they're like advertising it as like these aren't screens that would like hurt, that would have detrimental effects. And I feel like they're just making things up. So I just wondered, like, do you guys collect data on like what type, I guess, of screen, and like what screen is defined as?
I'm taking that. Thank you for the question. So we've been collecting like more traditional types of screens. We've been collecting TV, digital media use, including computers, laptop, handheld devices like phones, iPads, video game use, as well as types of kind of media use like Netflix, YouTube. We also collect social media use since 2020 during COVID. But the news, I think we also collect something like Leapfrog, like those educational screen, like for that. But the new screen, like no screens, you just said? Yeah, I've never heard of it, but I mean, we keep updating our tools, and yeah, I guess we'll monitor if there's any new devices being introduced.
Yeah, I guess some of the challenges, this is I think a challenge for us, and the technology is changing so quickly, and our systems are not nimble enough. I mean, honestly, they're just not nimble enough to change what we're asking, to administer it, to ensure the validity of our questions. Like, it is a huge challenge for us. And I mean, that's one of the things we theoretically would like to be able to assess with a directly observed like screenshot method. Because if you look at what your phone actually tells you about use, it's actually huge. It tells you time and tells you by app. So there you actually have very detailed data. I mean, I think one of the attempts in this legislation is to try to enforce the media companies to share some of this information, because the media companies actually know exactly what they're doing. So I think that could be a strategy. And some of the questions, the questionnaire-based questions, for example, in the Australia evaluation, actually ask such detailed questions down to which app, so we might be able to try to be a little bit more specific around that. And we're hoping to learn from them to see, people answering your question, as it's unclear whether or not people will give you that degree of detail. So great question. We have something online. So I'm going to try to summarize it. Something about the education system really changing over the years, and students at school are really directed to screens to receive their educational supports. For example, literacy tutoring during the school day instead of receiving the supports from educators. It's important to educate government representatives about how the cuts to education are impacting children. And this came up quite a lot in our forum. So I don't know if Michaela wants to speak.
Yeah, I can speak to just a few of the specific questions that came out within this larger priority of screen time use, and educators, as well as the other kind of knowledge users that attended, were very curious about how does screen use within the classroom impact all of these outcomes that we've been discussing. How do we best use screens to support children? And then how do things like examples such as summer school were coming up, where now kids in elementary school and high school are being offered full summer school online, where they're sitting for 8 hours a day in front of a screen or doing forms of asynchronous learning, which wasn't done before. So all of those kind of factors and how they shape these outcomes was definitely a focus, as well as I think educators are very aware, teachers are very aware of how these budget cuts affects what they can do in the classroom and their reliance on screens. So there was a lot of questions around, can we measure that? Can we measure how these changes in the education system are in connection with the overall screen use and then ultimately these outcomes? So I think it's very exciting to see those questions coming out of the education sector and just kind of continues to push the reasoning for doing a lot of this work.
Yeah, thank you. Another question that came up a lot from educators was around or observations that since COVID at lunchtime at school, many the screens are put on. So as a method to manage behavior or entertain or so there are a lot of concerns coming from educators and parents, like why are children not going outside? Why are screens on during sort of recreational time at school? So, these are a lot of, some of these questions are questions we can help answer. Some of these questions are actually questions I think that are best to be answered in the education system. So it's about sorting out like where are we best placed in our work to answer some of these questions.
Thank you. Great presentation. On the topic of the type of screens that you're collecting for, I'm wondering if there's a difference between like things that are placed, for example, TV, and then more like ambulatory or I should say like mobile devices that walk with like children, and whether or not there's a difference in the effects of those. Yeah. Can you hear me? Yeah, great question. Thank you. Yeah, I mean, we've been measuring, different types of device use like TV, digital media. We try to differentiate passive versus interactive screen use, like, having a TV in the background versus, actively engaging, video with some of the video games. But it's been hard to measure. It's hard to measure, whether it's mobile or you just put the screen there. I think that's a great idea to, collect those data moving forward. Yeah.
We used to characterize remember we used to say non-mobile and mobile, but now, it's really even hard if you think yourself, like, how would you even characterize, like classify? It's really complicated. But really important.
Do you see parents as allies in this?
I think we always have to see parents as allies. I mean, allies in what? I mean, allies in, I think it's an interesting question because it's in maybe I'm mischaracterizing it, but I'm not sure we see ourselves as necessarily like advocates, right? We see ourselves as, trying to answer the questions, research, trying to evaluate. So sometimes our thoughts and ideas are in a certain direction, but parents will say, actually, no, that doesn't apply to me. Maybe you can tell me a little bit more, but I think sometimes parents will have told us, especially with respect to the phone bans, the school phone bans at school, that there are a group of parents that are really concerned about their children not having access to their phones during the day, and they have concerns about safety, or they have a whole bunch of concerns. So I think we need to listen to the concerns and listen to their direction in terms of what are the key questions that they want answered. But I think there is a large variety and variation in parents' perspectives on this topic. I think if you ask parents to come and talk about any topic, like when we have our parent meetings, for our research meetings, like if you bring up screens, that's it, like that's the whole meeting. So it's something really, really, and I can say that for myself, like feels like a real challenge for our generation and families. So you do get different opinions and different priorities. But everyone's worried about it, I would say. Yeah. Great question. Hey, it's 1:00. I think maybe we'll wrap it up. And thanks everybody for great questions and coming today.